Hello, my name is Monica Dillon, and I'm coming to you all today to propose an informative health policy that I would like for you all to vote on and pass this policy so that we can inform the public about the different forms of illnesses that can affect their body and educate them on these illnesses and do a prevention measures to help them understand the seriousness of these issues. My health policy, I would like to propose and just give you a little rundown on it. This health issue affects the general public. This health issue has a serious impact on the community because the community isn't per se made aware of the seriousness of and the dangers that this illness can cause, different illnesses it can cause. So it is important for the community to be informed about any and all potential health issues would so that they could get so that they can get the policy, so this policy can be put in place with an emphasis on informing the public of the potential health issues and educate them on the seriousness of these issues. These health issues need to be addressed because it could potentially save lives and prevent future outbreaks of these health issues. My proposed health policy is a policy that is set into action that mandates that local health organizations have to set schedules to have classes to educate, prevent, and inform the public about the potential seriousness of health issues and the effect that they have on the public health. Everyone in the community and public will be affected by the policy. This policy will set the necessary steps headed to educate, inform, and prevent future occurrences. And from us informing the public, we can necessarily stop an epidemic about certain health issues that maybe people don't understand or even know about. In this health policy, I will address the health issues that are causing more and more problems that are potentially taking lives and that are causing people to become crippled or paralyzed. We need to inform the public of the potential dangers of maybe things that they eat on a daily basis or being around certain elements that can cause them to have a serious illness. And we have to make sure that they understand that the different illnesses that we speak of and talk about, we can prevent them with different preventative measures, such as when we educate them on ways of prevention, excuse me. We educate them on ways of noticing signs and symptoms of a certain illness at its early stages. We can educate them on the way we can educate them, excuse me, on the way to confirm and get tested for certain illnesses. And I would just make sure that I inform all administrative staff to make sure that they have the necessary things in place to make sure that their healthcare staff is providing the education when someone comes in with certain illnesses and elements. We have to make sure that as administrative staff that we are doing everything necessary to prevent future occurrences of a disease or to even help the disease process that they have right now and make sure that our patients are educated, they understand the steps and things that's necessary to not have this disease to occur again. And it is important for us as healthcare providers to make sure that we're doing everything possible to make sure that we are informing the public. The public is where it all starts. If we do not inform the public, then we are potentially can cause more harm than we are good. It is important for the public to understand that when it is necessary, we make sure that we inform them of all and any potential deadly illnesses that are out there. And if we do not do that, we're not doing our job. We first have to make sure that when we ask for these classes to be scheduled, we have to make sure that we have the staff and we have the necessary resources to provide these classes. And I know it's going to be kind of costly, but we have to understand that our first and foremost concern is the public and educating and prevention. If we can prevent outbreaks of diseases, we will be in a better state. Our country will be in a better state. But if we do not educate and have them to understand health issues and the potential effects it has on one's body, then we will not be anywhere. We will steady have health care to go to waste or steady rise. We have to remember that even though the United States has one of the richest countries, we are not providing health care to all people in the necessary way. We have to also make sure that we inform the public on the ways to protect themselves and to manage all things that are being given to them to help prevent, cure, or even treat a certain disease element that they have. We have to make sure that we focus on all populations, because although we have certain minority groups that are affected by certain diseases, we have to make sure that we are giving each minority group, each population, the chance to educate themselves, the chance to prevent diseases from happening. And if we don't do that, we have still failed. But my health policy is basically an informative measure to help the public to understand disease process. We have to educate the public, and we have to make sure the public understands and the community understands how to perceive certain things that we're giving to them to understand. It would make no sense to have a class you're trying to educate them on and they don't even understand what is being said and what is being done. We have to make sure that we put it in terms and in a way that the general public, lay people as they say, could understand disease process. And we have to also make sure that when we are putting any kind of policy into place, we have to make sure that we know we weigh out the benefits, the costs, the different elements that would either hinder or help the policy. We have to make sure that the benefits outweigh the bad. Even though with any policy, anything that you place into effect, you're not going to have 100% participation. But we have to have the overall understanding of what this policy is meaning so that we can have the necessary people to vote on it, and the necessary people will understand where we are coming from with this policy. We have to make sure that we tell them that with this policy, we're potentially saving lives, that we are potentially creating some measure to prevent more damage than we are trying to prevent the ones that have already maybe come in contact with this disease or these diseases, to be able to cope and understand the process of them. Because so many times people are diagnosed with diseases that they really don't understand, and they really don't have, the doctors or the nurses or the nurse practitioners don't have the real time to actually sit down and, in lay terms, again I say,